Hello, welcome to Flourish Nursing Academy. We'll be looking at infertility. Infertility is inability to achieve pregnancy after 12 months of regular unprotected sexual intercourse in women under 35 years and after 6 months in women over 35 years. Infertility is classified into two. We have primary infertility where there are no prior pregnancies, and secondary infertility when there is difficulty conceiving after a previous pregnancy. Infertility can be caused in both males and females. So let's look at the male causes of infertility. Number 1 is low sperm count. When the sperm count is less than 10 million sperm per milliliter of semen. Normal sperm count is 20 million sperm per milliliter of semen, or more. Number 2 cause is no sperm, where we see absence of sperm in the semen. Then we also have low sperm mortality, where the sperm are immortal. They cannot swim towards the ova. Another cause is abnormal sperm, where we have unusual shape, more difficult to move and fertilize eggs. Such causes include infection, where we have also testicular cancer, testicular surgery. We have overheating testes, our testicles, ejaculatory disorders like retrograde ejaculation, varicocele, including varicose vein in scrotum, undescended testicles, hypogonadism, where you have testosterone deficiency, genetic abnormality, mumps where it will result in testicular inflammation, hypospadias, and chlamydia infection. Causes of infertility in women. Ovulation disorder, where you have premature ovarian failure that's before the age of 40, who have polycystic ovarian syndrome. We also have hyperprolactinemia, which is found in non-pregnant states where the woman will start producing prolactin. Meanwhile, she's not pregnant. Then we have poor air quality. And then we also have problem in uterus, or the fallopian tube, where you have surgery, you have submucosal fibroid, endometriosis, previous sterilization treatment. Then other courses include medication like NSAIDs, example aspirin and ibuprofen, chemotherapy, radiotherapy, illegal drugs. Okay, so how do you diagnose infertility? We can diagnose it with a laparoscopy. We can also diagnose it with ultrasound. And we can also do that with sperm analysis in men. We can do that with HSG, which is hysterosalpingography. We can also do that with anti-Müllerian hormone, checking of other things like hormones. Okay, so what are the treatments for infertility in men? Premature ejaculation or erectile dysfunction. One of the treatments is the behavioral approach and medications. Then in varicocele, varicocelectomy. For blockage of the ejaculating duct, sperm can be extracted and directly from the testicles and injected into the egg. In the laboratory, the retrograde ejaculation sperm can be taken directly from the bladder and then injected into the egg in the laboratory. Then surgery for epididymal blockage. A bypass of the blockage can be performed called vasoepididymostomy, where the VS difference is reconnected to the epididymis. Then in women, number 1. Ovulation disorder. Fertility drugs are prescribed like clomiphene to encourage ovulation in cases of PCOS. Metformin is also used if the person is not responding to clomiphene in PCOS. And then, especially when the person is having insulin resistance. Number 2. Medical management, assisted reproductive techniques, intrauterine insemination, in vitro fertilization, intracytoplasmic sperm injection. Surgical management, laparoscopy for endometriosis, and tubal correction. hysteroscopy removal of fibroids, polyps, and adhesions. Number 3. Lifestyle modification, weight loss and gain, smoking cessation, stress reduction techniques, and counseling.